I'm Becky. I'm a 1-year-old Chihuahua, and I still live at home with my brother, Stanley, my mom, Lucy, and my dad, Doug. I want to be just like my dad when I'm older. He can sing really well. He's pretty smart. And I think he's gonna live until he's 100 years old.
Excuse me, young lady. Did I just hear you say you want to be just like your father? He already smells like he's 100 years old. You know why? His dental hygiene is horrible. Come here, Becky. Come take a seat with your mother. Let me tell you why you shouldn't follow in your father's footsteps. You need to take better care of your teeth than he did.
Oh, but why, Mom?
Oral care is so important for our health. If we don't take care of our teeth, it can really affect our quality of life. I want what's best for you, Becky. I don't want to see you have oral pain, inflammation, or get an infection if we can avoid it. It can really affect your overall health and even how long you live. Think of a human. You won't want to play with her if you're sick or in pain because of your teeth.
Okay, then what can I do to make sure that I have better teeth than Dad?
Have you ever heard of AHA, Becky?
No? Who the heck is AHA?
They're the American Animal Hospital Association. They're the pros who told me exactly how to keep my pearly whites in tip-top shape.
Aha!
Even the mean old cat upstairs follows these guidelines, and I think you can speak from experience when we say that her teeth work perfectly.
Oh yeah.
Now I know you're not going to be happy to hear this, Becky, but we're going to have to take some trips to the vet throughout the year.
Aw, the vet! I hate that place!
I know, but fortunately, they take the first step at our annual checkups.
Okay, well, what's the first step?
Well, first we have to get our oral exams done. They call it flipping the lip.
Flipping the lip?
Flipping the lip. When we visit for our checkup, the vet does a quick oral exam while we're wide awake. It doesn't take long. He'll just flip up your lip and take a quick look at your chompers. Now, if you want to make your mother proud, you'll even let him open your mouth and take a better look.
But Mom, what's he looking for?
The vet just wants to see if there's anything weird going on in there. He'll check the color of your teeth, your gums, your saliva. He'll see if there's any teeth fractured, wiggly, or missing. He'll look for tartar and calculus. And he'll see if there's any bleeding going on. He might poke around in there and see if there's any strange swelling or bumps in your mouth. And he'll try to see if there's anything that's hurting you by playing with your teeth in your jaw. Listen, the vet's a real handsy guy. He's gonna grab your head, your nose, your lips, your tongue. It can be pretty uncomfortable, but I swear, if you're real good for him, you'll most always get treats afterwards.
Huh. I bet Dad was pretty embarrassed at his oral examination then.
Of course he was. Not only is your father a drooler, but he had periodontal disease.
Ah! What's that?
Take a look at your dad's teeth before we got them fixed. All the structures that surrounded your dad's teeth were inflamed because of bacteria.
Ew!
Yep, that's what periodontal disease is. It affected his gums, the bones in his face, even the ligaments that helped to keep his teeth in his mouth. All the tissues around your father's teeth were harmed.
That's so gross! I don't want my teeth to get like that.
Well, this doesn't happen overnight, Becky. There's stages of periodontal disease. Stage 1 starts with a little tartar buildup, but the first main sign of periodontal disease is gingivitis.
Ginger what?
Gingivitis. This is the part of periodontal disease that shows inflammation of your gums. You'll see your gums get red and painful, and then they bleed really easily.
Oh no!
Oh, we're just getting started. Stage 2 is when you can actually start to see your teeth wear down, and then it might start to eat away at your bones. Gingivitis gets worse, and your breath starts to sting. Stage 3, we see all of that progress further. Gingivitis, bone loss, tartar buildup, it's all still there. Pockets start to develop between your teeth and gums, and they make nice cozy homes for all that bacteria. Now stage 4 is the final stage. This is what your father had. A large percentage of the bone in his jaw had been lost. His gingivitis was off the charts, and his gums even oozed. So much of the surrounding tissues had just been rotted away. He was in a lot of pain when he bit down on anything, and he even lost some teeth. And his breath? Don't get me started on his breath.
Okay, Mom, so what else can I do to make sure that doesn't happen to me?
Well, according to AHA, our next step is radiographs. We have to take x-ray pictures of your mouth to get a better look at your teeth and supporting structures.
But why do we have to do that when the vet just spent all that time looking at my teeth?
Well, even if you're a perfect angel for the vet during your exam, which I know you will be, there's only so much we can see when we look from the outside. When we do a dental radiograph, we can see everything. Your teeth, your bones, and everything under the gums.
Well, that makes sense. I guess I can do that, but how do they do it?
The dental radiographs are high-tech. They have a big machine that takes the pictures. They just punch in some numbers, pick out which tooth they want to look at, and then position you on the table. Put a little sensor in your mouth and snap some pics.
That sounds kind of scary. Putting a sensor in my mouth? That's a little uncomfortable.
Becky, you have nothing to worry about. They give you medicine to make you sleep through the whole thing. You won't even know what happened. This is the best way to make sure you're in the perfect position so they can get the best picture.
Oh, I can do that. I'm good at napping. So, what if they find any problems?
Well, then this is the time for a dental cleaning. Once again, Becky, you have nothing to worry about. You'll be sleeping for this entire procedure. First, the vet uses his curettes and scalers to scale your teeth to remove plaque and calculus. After that, he'll polish your teeth to make sure they're nice and smooth. This will help keep your teeth healthy.
Squeaky clean.
That's the goal. The vet will do another oral evaluation while you're sleeping, using a probe to poke around and feel. He'll also have someone chart what he sees so he can keep track of everything. He'll clean out any crevices that might have any gunk in there and make sure that everything is nice and clean. Then someone will call a human and let her know if anything needs to be done. They'll get her permission to treat anything necessary and let her know the costs. And then if he needs to, the doctor will do any extractions or any other treatments needed. Believe me when I say, when he saw your father, he had his work cut out for him.
Oh boy, that sounds like a lot of work.
It is, but it's worth it. After your father had his dental cleaning and treatment, he felt so much better afterward. He is much healthier and happier now, and he doesn't have any pain in his mouth anymore. If we do this early on, we can avoid being like your father. And that's the real goal, isn't it? We don't want you to get to that point.
You got that right. I really don't want to turn out like Dad.
Well, we don't have to rely on the vet taking care of our teeth. Home care is just as important as regular trips to the vet.
Well, what do you mean by home care?
Well, there are lots of things that we can do at home to help us keep our teeth clean.
Awesome. What kind of things?
There are two types of ways that we can keep our mouths healthy at home. Passive home care are things that we can do day to day that don't take much effort from a human. Things like chewing on the right toys and treats or eating specialized foods that promote dental health.
Easy peasy.
Active home care, on the other hand, takes a little more effort from our human companions. Things like brushing our teeth daily and giving antiseptic rinses to keep our teeth clean.
Aw man, are you sure all that stuff is really necessary?
Absolutely! Bacteria starts building up on our teeth within a day of us coming home from our veterinary dental health cleaning. Taking care of our teeth day to day is important to make sure that we prevent all those problems that Dad had. We'll need to go in less for our dental cleanings if we can keep up with our home care. And the more money our mom saves on vet bills means the more money she has to spend on treats and toys for us.
Oh, you had me at treats. How do I brush my teeth?
Well, first we have to pick out the right tools to brush our teeth. We should use a soft bristle brush or a finger brush and toothpaste that's made for us. The hard bristles on a human's toothbrush can hurt our gums, and her toothpaste makes us feel sick.
Got it.
We're starting you young and we're starting off slow. Our human left these products out for you to sniff at for a bit, so you can get familiar with them. It makes it a little less scary that way.
Oh, that's why she did that? I thought she just needed to clean up the house.
No, there's a method to her madness. Beware, she'll introduce the toothpaste first. She'll place a little in your mouth with the finger, and then she'll give you some treats afterwards. It's weird at first, but soon you won't mind the toothpaste, because, well, treats!
Yeah, I could get used to that.
I know you don't like to admit it, but you're spoiled, Becky. Our human wants you to be comfortable with your toothbrushing routine. That's why she'll take things at your own pace, introducing these things slowly before finally sticking that toothbrush in your mouth.
Spoiled? Me? No.
Yeah. But anyway, when you're ready, a human will start brushing your teeth daily. It's a simple task when you've become comfortable with it. She's just gonna put the toothbrush in your mouth and brush the bristles along your teeth. She'll focus on the side of the teeth that face toward your cheeks and your lips. As you get more comfortable with the process, she can increase the amount of time that she spends in there to make sure that your teeth can be as clean as can be.
Alright, but with all this advice, there's no way that I'll end up like Dad.
Well, we love your father, Becky, but we can learn from his mistakes. All of the dental problems he had were completely avoidable. There's no reason that any of us should suffer from gingivitis, periodontal disease, or any of the nasty problems that come along with it. If we take these precautionary measures, you can keep your pearly whites in tip-top shape.
Thanks, Mom.